Hello, and welcome to the third part of the Sleep and You series presented by Four Wing Health Promotion for the Sleep and You series as part of the Balance Library. So today we're going to be talking about essentially why we need to sleep and what can happen if we don't get enough sleep. So when we sleep, we conserve our energy to ensure that we are properly fueled to function optimally the following day. If we do not sleep, we're not going to have that energy. While we sleep, our neurons, which are our brain cells, sort through all the experiences we have during the day so they can properly be stored. This allows us to learn from them and allows us to remember. Sleep is also important for emotional regulation and stress management. When we don't get enough sleep, we have more difficulty managing our emotions effectively and we may feel more stressed. Our immune system also benefits from sleep, and we are less likely to get sick when we have enough quality of sleep. We also are more likely to get better quicker if we have enough sleep. Sleep also helps to regulate essentially all of our bodily functions, including our brain activity, our heart and lung activity, our metabolism, and endocrine activity. During slow wave sleep, or SWS, the growth hormone is also secreted, which is incredibly important for us. So when we talk about sleep deprivation, this is what occurs when a person does not get enough sleep. So the amount of sleep a person requires, or an adult between the ages of 18 to 64 requires per night, is 7 to 9. A third of Canadians are sleeping fewer hours per night than is recommended. And sleep deprivation can happen for various reasons. These reasons can include sleep disorders, aging, illness, or other factors such as stress or being a new parent. So let's look a little bit more into the reasons that we're sleep deprived. There are a variety of reasons an individual may be sleep deprived, and you might see one reason here, you might see multiple reasons. Your reason may not even be on here. Many people don't realize how important sleep is and instead think it's a waste of time. So essentially, we're programmed to be as productive as possible during the day and night, and sometimes our sleep gets put on the back burner. When we consider family dynamics, working parents with small children, single parents, or individuals who take care of their elderly parents may struggle to get enough sleep. When considering the military community specifically, we may see sleep be impacted when a spouse or family member is deployed, on course, or on IR. This could be a result of stress and worry, not being used to being in the bed by yourself, but also trying to align schedules in different time zones for communication. Social commitments include friends wanting to hang out, especially later in the evening or at night when you would like to be sleeping. Many shift workers have difficulty with sleep because shift work in its most basic form plays havoc on our circadian rhythms. So workers who have changing shifts can find it difficult to get into a regular sleep pattern. And night shift workers specifically may have difficulty sleeping during the day when it's light out and their circadian rhythm is sending those signals that they should be awake. We're going to have a whole session on shift work, so please check that out if you are a shift worker or live with a shift worker. When we travel, we may experience what's called jet lag. Research has shown that when we rapidly travel across 2 or more time zones, there is an abrupt desynchronization between our circadian clock and our new destination's prescribed sleep schedule. So essentially how you should be sleeping in your new destination. The severity and duration of jet lag will depend on the direction of travel as well as the number of time zones that are crossed. Regarding stress, research has actually shown that stress and sleep don't mix very well, which doesn't seem to be news to anybody. Stress can cause us to have racing thoughts, making it difficult to fall asleep or have a restful sleep. In turn, sleep deprivation can actually increase the amount of cortisol, which is our stress hormone. So it really becomes this quite vicious cycle. Sleep disorders, such as insomnia, sleep apnea, or restless leg syndrome, can impact our sleep greatly. And we've talked about sleep disorders on another session. So if you haven't checked that one out, please do, so you can learn a little bit more about specific sleep disorders. When we have other medical conditions, whether physical conditions such as asthma or arthritis, or a psychological condition such as depression or anxiety, our sleep can be impacted. Furthermore, pregnancy can also disrupt your sleep, especially during the third trimester. It can be really difficult to find a comfortable position, and the symptoms that some women experience with pregnancy can make sleep pretty difficult. Looking at medications, there are many over-the-counter and prescription medications that can disturb sleep. So if choosing to use a sleep medication specifically, make sure you're talking to your healthcare provider, as sleep medications could be used occasionally, but if used regularly, a tolerance can develop. and individuals may come to rely on the medication to sleep. So we want to try more often than not to work on our sleep hygiene habits versus relying on sleep medication. It's also important to not use another random medication for sleep when it's not meant to be used for that. Alcohol has also been found to make you drowsy and fall asleep, but disrupts your sleep and makes you restless. We do also have another session fully on alcohol and sleep, so please check that out to learn more. Caffeine and nicotine are also stimulants that prevent you from sleeping well. And lastly, lack of a bedtime routine can also impact sleep in that you're not giving your body any signals to realize that you're ready to get to sleep. So when you're getting into bed but you haven't gone through a routine, your brain's not interested in shutting down because it wasn't told it needed to shut down. So why do we choose to sleep less? So to be more productive, we often get rid of the things that are important to our overall health, like sleep and also physical activity and meal planning and prepping and eating well. So we sleep a little less to get more done during the day. This is often done during the week as we feel we can catch up on sleep during the weekend. However, when you continuously deprive yourself on sleep, you accumulate what's called sleep debt, which has effects on both your physical and psychological health. So trying to catch up on sleep while sounding like a good idea is actually more of a short-term solution for sleep deprivation, and it generally disrupts our sleep schedules even further because we're not sticking to consistent bed and wake times. So if you're, staying up later on the weekdays so that you can get more done, but you're sleeping in on the weekends, that's not a consistent schedule, and it can be really, really disruptive. So these are some signs of sleep deprivation, and this is not an exhaustive list by any means, but signs of sleep deprivation can include excessive sleepiness, yawning, irritability, daytime fatigue, the inability to concentrate, having impaired memory, reduced physical strength, or reduced ability to fight off infections. It's important to realize that stimulants, such as caffeine, are not enough to fight off or fix your sleep deprivation. So stimulants can actually worsen your sleep deprivation because it makes it more difficult to fall asleep at night. And this could potentially lead to a cycle of nighttime insomnia symptoms followed by reduced daytime functioning. And of course, when we don't function as well as we want during the daytimes and we feel sleepy, we may increase our daytime caffeine consumption. So again, ending up in a cycle that's not so great. So let's talk about what happens with the progression of sleep deprivation. So essentially, we're going to look at, in the gray, what happens after a few nights of not getting enough sleep. And then in the red, what happens after quite a while. So first, we'll look at the yawning, fatigue, and headaches. That happens after, 1, 2, 3 nights of not getting enough sleep. After a while, though, this can actually move into severe fatigue and headache. Remember that fatigue is the feeling of exhaustion that requires a time of rest. So it is not going to go away unless you rest. Next, we have sleepiness. So sleepiness happens when we haven't had enough sleep over a few nights. So this sleepiness is essentially the urge or need to sleep during the day that can be really difficult to push away. When we continue to deprive ourselves, we may experience severe daytime sleepiness, including sleep attacks, as well as nighttime insomnia symptoms, sleep anxiety, which is essentially feeling fearful or stressed about going to bed, and a reduction in our overall sleep quality. Being sleepy is different than being tired. When we're tired, we can fight sleep without any difficulty during daytime functioning. When we're sleepy, we are consumed by sleep. We need to sleep. So after a few nights, we have a reduced immune function, which means that we're more likely to get sick with something such as a cold or the flu. And over time, this immune system reduction can actually increase the risk of certain types of cancers, specifically colorectal and breast cancers. And again, in the short term, our hair and skin cells have difficulty regenerating, which can lead to some premature aging of our hair and skin over time. We may also experience premature aging of the reproductive system. So as an example, men may actually experience fewer sperm count. So after a few nights of sleep deprivation, we may experience weight gain, which can be as a result of hormonal deregulation, which essentially means that the hormones that control the feelings of hunger and fullness don't work properly. We could also experience glucose deregulation, which leads to cravings for increased carbohydrate intake and an increase in hunger. This makes us more likely to eat more and make less healthy food choices, which of course goes into weight increase. We may also experience higher blood pressure. Now, over time, if we continuously gain weight and experience chronic glucose disruption and increased blood pressure, we will be at a higher risk for diabetes, obesity, and cardiovascular diseases. Remember that sleep is important for our emotional regulation and stress management. So when we deprive ourselves of sleep, we often experience irritability, lack of patience, and increased stress. We may also experience a reduced interest in sex. Now, over time, these emotions and feelings can increase our risk of experiencing anxiety, depression, and burnout. When we don't have enough sleep, we may have difficulty paying attention or focusing on tasks, as well as forgetting things. This can, of course, have an impact on our academic or professional lives. Over time, our sleep-deprived state may lead to attention deficit or memory loss, causing major academic or professional implications. Injuries and accidents can happen when we don't get enough sleep, and the less sleep we have over time, the greater that risk. So when we look at insufficient sleep in the military community specifically, military personnel have been found to overestimate their own proficiency when encountering insufficient sleep. So essentially, they feel that they perform well or better when they don't have sleep. It's been found that after 17 to 19 hours without sleep, performance on some cognitive tests is equivalent and sometimes worse than having a blood alcohol content of 0.05%. An objective analysis of sleep habits of Canadian Armed Forces personnel found that men specifically are not attaining the minimal sleep guidelines of 7 to 9 hours. That's not to say that women are not are sleeping really well too. It's just found that men specifically are definitely struggling with this. Insufficient sleep has been shown to decrease military performance across the board. This includes weakened physical and athletic performance, increased risk of committing errors and causing accidents, decreased visual acuity, which is essentially the ability to detect shapes and details of the things we see, as well as impaired reasoning skills. Military personnel also have a poor mood, decreased motivation, decreased attention and alertness, impaired short-term memory, and chronic sleep deprivation has been linked to obesity and long-term health impairments, which we did just go over a little bit. Poor sleep can have a negative impact on all other pillars of health, including nutrition, physical activity, and overall self-care. We're too tired to exercise, yet exercise has been found to aid in promoting quality sleep. We're hungry for unhealthy comfort foods that are high in sugar, salt, and fat, which increases our weight, and we're too tired to meal plan or prep. And it's also been found that foods that are high in sugar keep us awake and disturb our sleep, increasing nighttime awakenings, and foods that are high in fat and salt could potentially be harder to digest, which also disturbs our sleep. Overall, when we engage in poor sleep, and that's not just quantity, but also quality, we have a decreased healthy lifestyle. Let's talk a little bit about drowsy driving, because sleep deprivation can lead to this. So again, when you're awake for 17 to 19 hours, you will drive as though you had a blood alcohol content of 0.05%. Now, when you're awake for 24 hours, you drive as though you had a blood alcohol content of 0.1%. So the symptoms of drowsy driving that we need to keep in mind is trouble focusing, heavy eyelids, an inability to remember part of the drive, constant yawning, head nodding or bobbing, or drifting from your lane. It is really important that if you've been awake too long that you don't even attempt to drive. But if you are driving, if you're experiencing any of these symptoms, that you need to pull over and take a break and a rest, or get yourself off the road completely. So let's put all this information together. So essentially, what does sleep deprivation do? So when we deprive ourselves of sleep, we are greatly affected overall. Our mood is affected and our ability to regulate our emotions diminishes. This can lead to a lack of motivation, impacting the frequency of our physical activity or reducing the likelihood for us to start a new training program. Our pain perception increases. So for anybody who is experiencing acute pain, but also especially those who experience chronic pain conditions, that perception is actually being even increased even more. It affects our ability to consolidate our memories, which can lead to us being inattentive and have difficulty learning. It affects our ability to fight off infection. So you may be getting sick more often, and you may be sick for even longer. It can worsen existing physical and psychological health conditions. And the cumulative effects added to the accumulation of stress and the inability to manage emotions can lead to a host of issues within our other health areas. We may also develop insomnia symptoms, leading us to have difficulty falling asleep at night, experiencing fragmented or disrupted sleep, or having an inability to sleep for a long period during the night. So that is it for this part of the Sleep in You series, but we have a ton more to offer you. So take a look at the rest of the Sleep in You series. That is a 7-part series from the 4-Wing Balance Library. We hope to see you on the next one.